Hello, and welcome to the online Student Nurse Health Education webinar, Sustainable Wellness for Nursing Students, Making Healthy Behavior Part of Nursing's Present and Future. Before we get started, I just wanted to take a moment to introduce myself. As your presenter today, my name is Charlene Weber, and I'm a registered nurse. As a doctoral student at the University of Phoenix, I'm currently undertaking a research study on student nurse health behaviors. I'm a professor of nursing at Lawrence Memorial and Regis College outside of Boston, Massachusetts. As a certified wellness coach and a certified personal trainer, it's important to me that health and wellness be brought to the forefront of nursing. In order to help with the health and wellness of others, as nurses, my belief is that we first need to help ourselves. Now, before moving on in the presentation, I ask that you please have a paper and pencil handy. Just a couple of questions that I'll be asking along the way. Thank you. Please enjoy the presentation. The goal of this presentation is to educate nursing students across all levels and programs so that they may further facilitate health behaviors in patients, families, and communities through education and modeling. Upon completion, participants will be able to do several things, and I'll let you go ahead and read those objectives on your own. Before we begin, let's get that paper and pencil handy. Take a few minutes to define what healthy behavior means to you. So in a few words, please describe what the term healthy behavior means to you. My guess is you probably said something like, healthy behavior means exercising every day, eating fruits and vegetables, getting daily fresh air and sunshine. Perhaps you thought healthy behavior meant self-care, work-life balance, managing stress. Healthy behavior might mean to you a healthy lifestyle, living a balanced life, mental and physical health, or something similar. Now I'd like to ask you what I call the million-dollar question. Regarding those health behaviors that you just talked about, how often do you engage in those behaviors yourself? Now, if you're like many of the nursing students that I've asked that question to before, you may have answered something like, healthy behavior? What? Me? Healthy? I'm a nursing student. I don't have time for health. Now, over a decade ago, the Arista 3 conferences, which are a group of nursing leaders brought together to talk about nursing and our role in society, identified health promotion and disease prevention as roles and activities in which nurses could make the strongest contribution. Most nursing students understand health promotion. They understand what to tell others in terms of exercise and healthy eating and weight management and stress management. And yet, nursing students tend not to practice these behaviors themselves. Today, according to the AACN, the American Academy of College of Nursing's Baccalaureate Essential 7, health promotion and disease prevention at the individual and population level are necessary to improve population health and are important components of baccalaureate generalist nursing practice. Nursing students are taught that one of the primary roles of professional nurses include health promotion, disease prevention, and wellness education. Using the nursing process, nurses are taught to engage in a multidisciplinary approach to improving health that focuses on well lifestyles to boost health and prevent illness. According to Zheng, Ching, and Loke, wellness is concerned with quality of life in all individuals and in all settings, but is most useful in preventing illness. However, a significant problem exists. And again, using that paper and pencil, I just want you to answer. Do you feel you are a credible role model of information on physical fitness, proper nutrition, weight control, and stress management for your patients? Yes or no? I've asked that question before to a group of nursing students and nurses in a discussion on educating patients on physical fitness, proper nutrition, weight control, and stress management. And they commented, "Who are we to educate patients on diet and exercise? Look at us." One said, "I can't talk about these things with patients when I don't do them myself." Another one said, "Yes, we're supposed to talk about these things with patients, but I don't." Looking at herself, she said, "I'm obviously no expert in weight control." And another nurse said, "I just avoid these topics altogether. I am no role model of health." Clearly, a disconnect exists between nursing's prescribed role of promoting health and the personal health behaviors of nurses and nursing students. As mentioned, many nurses struggle with addressing issues like obesity, inactivity, sound nutrition, and stress with patients because they themselves struggle with these issues. Nurses must become more intimately acquainted with strategies for sustainable personal wellness so that they can act as credible role models of health for others. Many nurses and nursing students feel a cognitive dissonance in practice that keeps them from addressing certain issues like smoking, obesity, inactivity, and stress that they themselves struggle with. And a cognitive dissonance can be looked upon as a conflict, frustration, anxiety. Again, feeling that they're not a role model for health, they avoid talking about these things with patients and others. And one of the problems, as I see it, is that a nursing model to promote health and wellness within the nursing profession does not exist. How are nurses and nursing students to promote health and wellness in others when their own health and wellness receives such little attention? Therefore, I present to you a model for sustainable wellness. This model promotes sustainable wellness of body, mind, and spirit. It assists nurses and nursing students in living well through a model for daily living. It addresses what's known as the obesogenic character of American society that contributes to overeating, physical inactivity, and the social, physical, and psychological consequences of these practices. What is the purpose of sustainable wellness? The purpose is to explore, expand, and integrate sustainable wellness strategies throughout the discipline by bringing health and wellness to the forefront of nursing practice, education, and research. It must be recognized that many nurses struggle with the same general health concerns as approximately 60% of American adults who do not engage in recommended amounts of physical activity. 26.8 million Americans suffer from coronary artery and heart disease. 34% of American adults are obese. 25.6 million have adult onset diabetes, and over 1 million Americans will be diagnosed with colon cancer this year. Millions of people struggle with stress management. To act as credible role models of health, nurses and nursing students should engage in lifestyles based on a model for sustainable wellness. I believe we must start by promoting wellness in nursing education. Nursing curricula speaks of the role nurses have in health promotion and disease prevention, but there is little or no formal training in how nurses will encourage and maintain their own health. Primacheck reported 1/3 of a group of nursing students had reported stress severe enough to provoke mental health problems, including depression and anxiety. Malik, Blake, and Batt in 2011 investigated the self-reported health and lifestyle behaviors of nursing students and found that they did not transfer their own health teachings to their health behaviors. Nearly half of the research sample did not achieve recommended levels of daily exercise, and only 2/3 of them consumed enough daily fruits and vegetables. In 2009, Johnson found that in terms of increased confidence, academic success, and management of personal health, nursing students benefit from health and wellness strategies. Nursing is a stressful career. Nursing education can frame curricula to emphasize sustainable wellness as a health-promoting intervention in the long-term health of nurses. A model for sustainable wellness allows nursing students to adopt a philosophy of life, practice, and research that prioritizes wellness of body, mind, and spirit. To truly provide health care in the 21st century and beyond, this must become the essence of nursing education and practice. So what are the components of this model for sustainable wellness? Well, sustainable means capable of being sustained. And the three components of the sustainable wellness model are mindful nutrition, daily physical activity, and stress management. The three combine to sustain wellness. What I'd like to do now is to talk about the three components individually, beginning with mindful nutrition. To understand mindful nutrition, we first need to understand what mindfulness is. Often referred to as the art of conscious living, mindfulness has proven useful in healthy lifestyles, and it involves attending to behaviors of the present moment. Therefore, mindfulness can be applied to eating, exercise, and stress management. According to Ludwig and Kabat-Zinn, the goal of mindfulness is to maintain awareness moment by moment, disengaging oneself from strong attachment to beliefs, thoughts, or emotions to develop a greater sense of emotional balance and well-being. By strengthening one's internal resources through mindfulness, nursing students can learn to participate in their own self-care and, as Ludwig and Kabat-Zinn suggest, increase their desire for change in behaviors related to healthy lifestyles. Improving physical and emotional well-being, mindfulness training deepens people's understandings of themselves and their place in the world, and may be an effective measure to improve quality of life and self-compassion in healthcare professionals. Practicing mindful nutrition is not difficult, and it begins by developing self-awareness. First of all, are you hungry? Or are you eating as an emotional response to anger, hurt, anxiety? Are you eating because of a visual presentation of a certain type of food? Mindful nutrition requires one stop, think, and listen to the cues their body is giving them regarding food. Mindful nutrition also requires one learn to make choices in beginning or ending a meal based on awareness of hunger and fullness cues. Mindful nutrition requires one to learn to identify personal triggers for mindless eating, such as emotions, social pressures, or certain favorite foods. With mindful nutrition, one values quality over quantity of what they're eating. In other words, they are satisfied with eating one cookie as opposed to 6 cookies. They appreciate the sensual as well as the nourishing capacity of food. The bottom line of mindful nutrition is one eats to live, not lives to eat. Now again, using that pen and paper, I ask you to review. What does mindful eating involve? Does it involve calorie-laden desserts? Eating only lettuce at lunch? Does mindful eating involve eating to live as opposed to living to eat? Does mindful eating involve avoiding fruits and vegetables? If you pick C, you're correct. Again, eating to live, not living to eat. In other words, choosing nutritious, wholesome foods to sustain life as opposed to eating simply in response to emotions, habits, social cues. I'd like to offer you some tips for healthy, mindful eating. First of all, think about the colors of your plate. Focus on color. Reds, oranges, greens, yellows, red peppers, yellow peppers, orange carrots, green lettuce, green beans, green peppers. Lots and lots of beautiful colors on that plate. If you want to choose reduced or low-fat dairy, don't forget your bone health. Choose lean protein sources. Minimize red meat. When eating out, share or ask for half portion. Take the other half home. When cooking, use lower fat, lower caloric ways to cook. Grilling or broiled as opposed to frying. Choose whole foods with limited processing. Know your ingredients. Read labels. All of your grains should be dark, not white. Choose whole wheat, multigrain, oat, pumpernickel. Choose at least 5, but please aim for 10 servings of fruits and vegetables every day. Become familiar with serving sizes. I'm sure you'd be very surprised to know that a banana average size is 2 fruit servings, not 1. Also, role model for others. Instead of that high-fat pasta or potato salad, at your next party, bring a colorful fruit salad, a colorful green salad. Be the voice for change when it comes to healthy eating. I want to introduce you here to some websites with some great information on them, most of it entirely free. One is Spark People, and in terms of healthy eating and exercise, this is probably the largest healthy living community that exists on the web, and I've given you here the web address, www.sparkpeople.com, and you can register there, set yourself up for lots of workshops, recipes, lots of great stuff in terms of healthy eating. And of course, the United States Department of Agriculture, they have www.choosemyplate.gov and provide you with lots of daily food plans for healthy and mindful eating. And just to get you thinking a little bit more about your levels of stress, I'd like to ask you, how often do you feel stressed? Never, sometimes, often, or always? And again, please use that paper and pencil or pen and pencil that you have to answer that question. Most nursing students that I've asked that question to answer either often or always. Stress in nursing school is simply unavoidable. You might wonder, what exactly is stress? I know I experience it, but how is it defined? Stress is the condition or feelings experienced when a person perceives that demands exceed the personal and social resources that he or she is capable of mobilizing. In essence, a stressor is anything that causes stress. However, the degree of stress which any stressor causes is dependent upon a couple of things. First of all, it's the degree to which the stressor is present. In other words, if you have one exam, you probably feel stressed. If it's finals week and you have several exams, you're going to be extremely stressed. However, people interpret stress differently. Okay, so the level of stress is also dependent upon how the stressor is perceived. Different people view stress in different ways. For example, someone may be very motivated to study, to crack down, hit the books during finals week, where another person is immobilized by the thought of all of those exams. As a result, one stressor might produce distress in that latter person and produce eustress, or that good or positive stress that allows the studying to really be accomplished in another person. Now, not only is nursing school stressful, but nursing itself is a stressful career. Research has investigated causes of stress among nurses, and several themes emerged, including the amount of work with inadequate staff and time pressures, relationships with other clinical staff, leadership and management styles, feelings of no control, poor group cohesion, or lack of supervision. And then, of course, you probably experienced this as students already, coping with the emotional needs of patients and their families, poor patient prognosis, diagnosis, and then death and dying of patients. How do we manage the physical and psychological effects of stress before they take their toll? Now, it's important to check in with oneself periodically and look for some of these signs and symptoms of stress. Tension and irritability, fear and anxiety about the future, difficulty making decisions, being numb to one's feelings, a loss of interest in normal activities or a loss of appetite, nightmares, recurring thoughts about the event, maybe anger, maybe an increased use of alcohol or drugs, sadness or other symptoms of depression, feeling powerless, crying a lot, sleep problems, headaches, back pain, stomach problems, or trouble concentrating. These are all physical and psychological effects of stress. Therefore, it's very important for nursing students to learn healthy modalities for dealing with stress. Exercise, proper nutrition, music, dancing, being outside in nature, at the beach, yoga, relaxation breathing, warm baths, and essential oils are all healthy modalities for dealing with stress. Now, I must tell you, although this third component of the sustainable wellness model is daily physical activity, I also like to introduce it right here when we're talking about a healthy modality for dealing with stress, because it's so very important. Daily physical activity. I call daily activity a panacea for illness. What is a panacea? A panacea can be thought of as a miracle cure. Okay? This panacea prevents cardiovascular disease, high blood pressure, overweight, obesity, depression, and complications from diabetes. This panacea may prevent some forms of cancers, type 2 diabetes, and metabolic syndrome, as well as a host of other chronic illnesses that plague Americans. This is chemical-free, easily sustained, incorporates fresh air and sunshine, and can be shared with friends and family. This panacea does not require a physician to write a prescription. It can even prevent death. And imagine this, it's absolutely free. What is this magic potion, you might ask? This magic potion is physical exercise. Physical activity, anything that gets your body moving. From my perspective, exercise is a panacea for illness. In terms of health benefits, exercise stands alone. It can control weight, reduce risk of cardiovascular disease, reduce risk for type 2 diabetes and metabolic syndrome. It reduces risk of some cancers. In addition to strengthening bones and muscles, it can improve mental health and mood. It improves one's ability to do daily activities and prevent falls in older adults. It increases your overall chances of living longer and healthier. In terms of exercise, a lot of people are wondering, how much physical activity do I really need? Well, adults gain most of the health benefits when they do the equivalent of at least 150 minutes, slightly less than 2 hours of moderate intensity aerobic physical activity each week. However, additional and more extensive health and fitness benefits are achieved with even more physical activity. For sustainable wellness, I recommend 60 minutes every day. Yes, every day. If 60 minutes is a problem, exercise can be broken down into smaller sessions, 4 15-minute sessions, 6 10-minute sessions, whatever it takes to get that 60 minutes in. Particularly for those who have not been physically active in a while or are not currently physically active, there are some very important things to talk about surrounding daily physical activity. First and foremost, before all activity, a dynamic warm-up is necessary. What is a dynamic warm-up? A dynamic warm-up is spending about 5 to 10 minutes on warming the body and preparing it for exercise. This should not, however, include static stretching, stretching and holding a stretch. Dynamic movements are basic movements, marching in place, for instance, toe touches, raising the knees up while bringing the arms down, elbow to knee, side jacks without a jump, just tapping the right arm and the right foot to the right side, left arm and left foot to the left side. Again, stretching and warming the body for exercise dynamically. I have lots of information here on times for exercising, and these are recommendations by the Centers for Disease Control and Prevention. Muscle strengthening activities should be done involving major muscle groups on 2 or more days a week. I recommend 3 days of the week, either a total body strengthening program or doing upper body a couple of days a week and lower body a couple of days a week. Flexibility exercises, stretching, and yoga, very, very important. People who exercise tighten up their muscles naturally. This is good in terms of staying strong. However, it can also cause discomfort, sometimes even pain, when the muscles get super tight and have not been stretched. So stretching after working out is very important. Bottom line in terms of how much, don't worry about it. Please, just get moving. That's the bottom line. Think about How can I move more? How can I incorporate normal physical activity in my daily life? And let's talk a little bit more about that. As opposed to thinking about traditional exercise when you think about activity, I'd like you to think about movement. Ask yourself, how can I move more? How can I incorporate regular movement into my daily life? Welch said, movement is a medicine for creating change in a person's physical, emotional, and mental state. I truly believe this to be true. When thinking about how you can move more, there are a few questions you can ask yourself to incorporate extra movement in daily life. Where do you park your car, whether it's going to class, going to work? Think about, can I park a little further away and walk in? As opposed to being right next to the door, you might be able to add 10 minutes of walking, going into work, and 10 more minutes leaving work. In terms of the workplace, worksite wellness programs are often available. For students, most campuses have wellness programs on campus. Simply going to the campus gym is probably a good start. Ask, what's available for students? How can I get involved in these things? The buddy system has been proven effective in keeping people motivated and consistent with exercise. Find a buddy. Another nursing student would be great to exercise with you. Of course, we have more formal exercise programs. Zumba right now is very popular if dancing is something that people enjoy. CrossFit is another very common program right now. Bottom line, find something you love to do and do it. Commit to be fit. Oprah Winfrey said, people don't change because of what they know. People change because of what they feel. Mark my words, when you commit to be fit, you will feel very, very good. As with nutrition, several fitness websites are available. A couple of my favorites are the PALA website, the Presidential Active Lifestyle Award website. There's a challenge posted there that will help you add physical activity to your life one day at a time. And I have the website right here for you. And again, Spark People, we talked about that earlier with mindful nutrition. Spark People is a wonderful website for fitness, videos, lots of great information. Again, I'd like you to take that pencil or pen and think about what we've just talked about, particularly about warming up before physical activity. When we warm up before physical activity, should we make sure to include dynamic movements that warm up the whole body? Should we stretch holistically prior to exercise? A warm-up might not be necessary at all. Or should we sprint to really get those legs moving and that blood flowing? What do you think? A, B, C, or D? The correct answer is A. Dynamic movements that warm up the whole body for 5 to 10 minutes is perfect. In continuing our discussion of sustainable wellness for nurses, I like to think about the existing meta-paradigm of nursing: nurse, environment, health, and person. It's a relatively static nurse-environment dynamic. Sustainable wellness for nurses and nursing students adds new concepts to Nursing's Meta Paradigm to address wellness, creating an active, energy-focused dynamic in the nurse-environment interchange. Sustainable wellness would include not only nurse, environment, health, and person, but also focus on prevention and wellness through daily exercise, mindful food choices, stress management, resulting in health promotion of self. Within President Barack Obama's Affordable Care Act is a provision for preventive services. Within that provision, it stated that nursing must take an active role in providing a broader scope of care that includes an orientation toward clients in good health, as opposed to only those who are ill. This active role begins with personal health and wellness among nurses and nursing students. When we speak of nursing research, we understand that primary goals for conducting research are to generate new knowledge that has wide application to promote positive health outcomes for a particular patient population, enhance the overall quality and cost effectiveness of care, improve the healthcare delivery system, and validate the credibility of the nursing profession through evidence-based practice. Why not begin with studying ourselves? What questions might we ask? Knowledge regarding the health and wellness practices of nursing students is limited. Increasing this body of knowledge is important to those who believe that caring for others begins with care of self through health behaviors. A model to assist nurses and nursing students in achieving sustainable wellness involves choices of health behaviors such as mindful nutrition, daily exercise, and stress management. Sustainable wellness can bridge the gap between the nursing profession's prescribed role of health promoter and its ability to role model good health. Certain aspects of health and wellness, including normal weight, engaging in daily exercise, sensible eating, and managing stress, are attainable by those who firmly commit to changing behavior. And dare I say that part of this commitment requires nurses and nursing students putting themselves first. Again, based on the premise that one cannot care for others until one adequately cares for self. The personal health of nursing students through sustainable wellness strategies will substantiate a new model of nursing practice whose time has come. And again, I have a poll question for you. Healthy behavior among nurses and nursing students is A, impossible, B, hopeless, C, a habit, or D, a personal choice. What do you think? The correct answer, of course, is D, a personal choice. Every day we make choices regarding health behavior. Where will we park? What will we eat? How will we spend any free time we have, even if that free time is 30 minutes? Putting self first, living well. And as we wrap up today's presentation, I'd just like to talk with you a little bit about making the journey toward improved health and wellness. I'd like you to think about a healthy behavior, either one that we spoke about today or even something that we hadn't mentioned. Think about how and why this behavior is important to you. How is it important to you now, and how will it be important to you in the future? How does it or will it affect you as a nurse? If you already are a licensed practicing nurse, how does this behavior affect you currently in your professional life? I'd like you to write down 5 to 10 strategies that might help you to achieve this behavior. What barriers do you see in achieving this behavior? And how might you overcome those barriers? And finally, using the alphabet, I'd like you to please assign an element of knowledge gained on personal health and wellness to the assigned letter. For example, A, activity. Perhaps you've decided to incorporate more activity into your daily life. For example, walking instead of taking the elevator, parking your car further away from where you need to go. That kind of activity. I hope you've learned a lot about health and wellness and how important it is for nursing students. Please don't forget to incorporate these behaviors into your own lives. In order to take care of others, nurses must first take care of themselves. If you could now do me the favor of putting your email address in the comment box below this YouTube video. In 2 weeks, I'll send you the second electronic survey. Very brief, 25 questions. You'll fill it out electronically and send it back. Thank you again for your time. Be well.